Friday, 10 p.m. to midnight Eastern Standard Time, as I launch this great experiment in live talk radio on all of the stations, Rumble being the flagship, but also tonight I'm live on YouTube with the assumption that we're not going to say anything that has to be censored. Michael Beatrice is my guest. Michael is the author of The Science versus the Lockdowns. This is his latest book in his examination of the pandemic. Michael, thanks for joining me.
Hey, thank you, Charles.
So, Michael, I think that recently Johns Hopkins University Krieger School have published a report, and they're the ones who, one of the groups that actually originally recommended the lockdowns, that has now questioned the efficacy of locking down the whole country, not to mention much of the rest of the world, as a way to respond to the COVID-19 pandemic. So let's talk a little bit about the lockdown itself and how that intersects with science versus politics.
Good. First off, it's nice to be back. The last time you and I spoke or had an interview was Election Day 2020.
Oh, yes.
If you remember.
I think I do. Yeah, that's right. In between my watching things, and yeah, exactly.
I still remember the hat you were wearing, and we yeah, it was interesting. And it's funny. 14 months later, 15 months later, we're still talking about this, and really kind of the direction of the country, and a lot of things have changed, and a lot of things are the same since then.
Indeed. And I mean, I don't think I'm being too controversial if I say that it's not over, but let's leave that right where it is. All right. Because, I am streaming live on YouTube. And of course, since the election, there are certain topics that are verboten, if you get my drift. So, Michael, but you have researched heavily the pandemic. Right. And I think that one of the things that struck me, and I did a report on this in my sociology class, actually, I did some research, was I compared the United States to Sweden, and I compared various American states to Sweden. And Sweden did not do any lockdown. They didn't have even masks. They didn't have social distancing. They did practically nothing. They did put in some common sense mandates to limit the number of people in a crowd inside, because after all, we are talking about a virus here. And they also took steps to protect their most vulnerable people in nursing homes and hospitals. They didn't do a great job with it, but at least they focused on that, which of course was not necessarily the same thing done in several of our blue states, particularly New York, where you had Governor Andrew Cuomo putting COVID-19 active people in hospitals, and I mean in nursing homes, which I would suggest was genocidal because it led to thousands of deaths. But the point I'm making here is that Sweden's final tally, if you will, and the statistics bear this out, was that their hospitalization rates and their death rates were really no different than nations and states that did a full lockdown with masks, mandates, shutting businesses, and all the rest. And in fact, their general numbers were actually slightly less. So what does that say about the lockdowns?
So there are a lot of big questions there. First off, the idea that you came up with in terms of comparing sort of controlled states, controlled environments that really had few restrictions compared to those that had tight restrictions. Those are good comparisons. We haven't really done any scientific studies, but I like those comparisons. And let me step away from just Sweden, because it's easy to cherry pick just Sweden because they were very relaxed. Sweden was below average relative to the overall EU. They were higher than average compared to their Finland and Norway, their two neighboring nations, but on a 3-year average of excess deaths, really about the same. So, but really, if we keep this maybe closer to home, we've been sort of gifted where we've got some states that had very tight restrictions over the last 2 years, and some states that had much more relaxed restrictions. And so if you take a look at the hospitalizations and the deaths, what you'd want to think is that tighter restrictions should result in fewer people getting sick and dying. That is why you do this stuff. There's a cost to that in terms of education and economics and health, psychology, general well-being, things like that. Things we're all familiar with by now. And so if you try to do a correlation between, and I wrote a whole chapter on this in the Science versus the Lockdowns book, where I called it the burden of proof, and I compared all these different components, these stringent states compared to the less restricted ones. It's very difficult to find any correlation, right? One of the tightest restricted states throughout this whole thing is Hawaii. They've also, I think they're last in deaths. But you know what else they're last in? They're last in their percentage of obesity. And so there's a higher correlation to obesity in bad COVID outcomes per state than there is even age. And so you would think that Florida and Maine, because they have the two oldest populations, they should be, based on the way that COVID is age stratified, they should be they should have the highest percentage of death counts per capita. They don't. Maine's at the bottom, Florida's right in the middle. But when you look at states like Mississippi and Louisiana, Alabama, all those, kind of southern states, you look at even Texas, you go up to Iowa, it's crazy. I did this just a couple of days ago to refresh. And when you overlay the obesity rankings and the death rankings, it is the highest correlation, much higher than closing schools or closing restaurants and mask mandates and things like that. Another really good study that I did, I don't know if you saw this, I did it with a couple guys that are connected to our Rational Ground, just some brilliant people over there. And so in early January, we took the 12 states that had mask mandates in schools across the board. And then we took the 10 or so states that had no mask mandates, masks optional, but few people wearing them, for sure in my state in Texas where I live. And if mask mandates were effective, fewer kids and teachers should be getting sick. I don't know how else to say it, right? That's what you do this for.
Right.
And so the average pediatric hospitalizations in the mask mandated states was, I think it was 4.9 per 100,000. And the pediatric hospitalizations on average in the 10 states with no mandates, with mandates where you couldn't have a mandate, those include places like Florida and Oklahoma and Texas, et cetera. Texas was in litigation, but that counts for the most part. That average was 4.2, right? So if 4.2 pediatric hospitalizations per 100,000, the difference is 0.7. When you consider for inflation, meaning that there's a lot of kids that there's estimates of 50 to 70% of hospitalizations with kids that they weren't sick with COVID, they just tested positive. Then it becomes really negligible, right? I don't care how many times you look at a sort of a study or somebody saying, well, masks really work. If they work, we should have just simply had a markedly different outcome in the number of pediatric hospitalizations in these areas. No matter how we keep looking at the data and cutting it up different, we can't find a correlation between a better COVID outcome and tight restrictions. And I hope this is a lesson learned for us, in the future.
Well, one of the lessons, before we talk about children, that I think is critical to understand is that the vast majority of people who were hospitalized and who died from COVID-19 were either over 80 years old or they were, as you say, obese, and a lot of the health conditions that are attendant to that, like diabetes and other existing conditions. And I think that, if there's one thing we can learn from the COVID-19 virus, and we ought to learn lessons, we ought to learn political lessons, but also medical lessons. And the medical lesson is that we're too fat. Look, if you take a look example, and by the way, I'm in that category, so I'm not I'm not judging anybody here. If you take a look at, like pictures of people on the beach in the 1960s, their bodies were more normal. There was less, you saw an occasional person who was heavy or who was obese, but most people had normal proportions. Whereas if you see pictures of people on the beach today, it's an overwhelming number of people are obese. And so there was something that happened in our society between 1960s and today that we need to learn. It's like when a plane crashes, right? The FAA comes in and they do a full investigation to find out what happened and what they can learn. Was it a design flaw? Was it old? Was it age? Was it, human error? All of the different things. And then they file a report. And if they find things that can be improved, they do that. They make the improvements. I mean, it reminds me, 1943 in Boston, you had the Coconut Grove fire, where something like 75 people were incinerated to death because the doors weren't swinging out. They only could swing in. In fact, I had a relative who died in that fire in Boston. And so as a result, they learned that when you build a venue, you have to have the doors go out. So we can learn from the medical condition here, and that is that we're too fat. And the reason I think we're too fat is because of the sugar lobby and the fast food companies are putting sugar in everything. There's, corn syrup, you name it. There's that they squeeze the sugar into everything. And the reason they put sugar into everything is because sugar goes right into your bloodstream. It's addictive. It makes you crave more. And so they sell more.
Well, let me take a second and build on your obesity comment, kind of with some other worldwide data.
Sure.
One of the things that circulates around the news and kind of in the Twitter world around people that are in fact, Tom Friedman had made a comment, a former CDC director. He had made a comment about 2 weeks ago, and his comment was, if only we had done what Japan did, we would have had, basically no COVID deaths or bad outcomes, very low. And so I did a reply to that. And by the way, I'm a pretty nice guy on Twitter, right? I really don't want to spar. My charter in this whole journey is really to help people. I'm not out there to get into anything with anybody. But Japan's obesity percentage is 4%. And America's is, depending on the stat you read, 36 to 40%. It's impossible to compare Japan or South Korea or China or so many other, India,
Africa.
Or every place in Africa. Impossible to compare those because there's not one country that had lower than 10% population obesity that had a really bad or high COVID death outcome compared to all the countries that got ravaged had 18 to 20% or higher. So when you look at countries that really got it, you look at UK and several other countries in the EU and the United States and Czechia, et cetera. These are all places that had high levels, high rates of obesity. And so I don't know that it's the obesity shaming part of it. I feel like the CDC and people in the media and healthcare professionals should feel as comfortable calling out being overweight as they do smoking. You want to smoke, have at it. Know that it's dangerous. It's not the most healthy thing you can do. It probably shortens your life, et cetera, et cetera. That same public health message should be called down about obesity. And I can tell you I might have casually known that being overweight wasn't healthy before COVID, but this isn't what I did. And I'm not a healthcare expert. This isn't what my career is in. But I've been alarmed at seeing all the collateral illnesses that come as an offshoot of being overweight. Absolutely. And it's criminal.
Yeah.
And the other thing that's really criminal about kind of our messaging over the I wrote about this, Charles, in April of 2020 in my first book. So this isn't like new data. I knew this data along with a lot of other people as early as April 2020, right? And we locked down in late March. And we just haven't done a good job of messaging about this. And so when you look at we wonder why we have vaccine hesitancy. So I will give you my position on this. I do think the vaccines both have a protective benefit. It's not 60 times, it seems to be 2 to 5 times, but there seems to be some protective benefit to the vaccines. There also seems to be a risk of taking those for people much higher than any other vaccine. Those two things coexist and they're real. And so the real public message should be not everybody get vaccinated all the way down to your 5-year-old or whatever is allowed right now. Rather, I think it's 11. Rather, it should be if you're over 50, there's probably more upside than downside. I think that's real. I'm 55. I'm skinny. I climb mountains, and I got the J&J shot in May of 2021. Why? I knew I could be an outlier, and my downside probably wasn't that high. But by the CDC and everybody's messaging, the politicians around, hey, everybody should get vaccinated. The people that really would have had some protective benefit from it, there were resistors out of that because they didn't believe it, because the messaging was not truthful. It wasn't accurate, and a lot of people saw this, and the data's out in front of us. And so, again, a lot of learnings for us. The CDC clearly needs an overhaul. In leadership, in messaging.
The New York Times recently mentioned that the CDC is only publishing a tiny fraction of its data, which I think is scientific malpractice. But as far as the vaccine goes, and I've had the vaccine, I had the Pfizer, and I felt, again, like you, I thought that the benefits outweighed the risks, and I don't recommend, this, it's a personal decision. I don't condemn, I don't condone. I'm just saying that look into it for yourself and make your own decision about this. But, the thing is that I think that a lot of people are now coming around to your point of view, which is that it's really not necessary for everybody. You have young, healthy people, children. I mean, we should get into that topic. I think that the number of deaths amongst children for the COVID-19 vaccine, the COVID-19 virus was, I believe, 0. And, the hospitalizations were mild. It wasn't like,
Well, so we did have, there were maybe 700 or so 18 and unders that died, at least testing positive with COVID. I think the more takeaway is COVID for really healthy people under 30 were not measurable compared to other causes of death. It's not an exaggeration to say the flu killed on average in a given year would take more youth lives than COVID. That's just real. Swimming pools, getting in a car. And so there's a point when we just need to live. Whereas if you were over 50, COVID was real. And if you're over 65, COVID was really real. And it's why, a good practice was my now 90-year-old mom and her 90-year-old husband live in Detroit, and we kept them under wraps for, now it's been going on 2 years, but I've still encouraged her to keep a low profile. COVID, we're letting this thing go right now, but our COVID numbers in terms of cases, hospitalizations, and deaths, they're declining, but they're higher than many other points that we had super tight restrictions all over the country. So, you still want the people that would be most vulnerable, we know who that is, to be respectful of this and cautious. But, when you're talking about healthy people under 30, there was never a reason after May of 2020, the data supported that we should, lock down and restrict these poor kids.
Right. I mean, I think it was particularly wrong and frankly, almost criminal to shut the schools. They did not do that in Sweden, not to single Sweden out again, but, to have kids be home for a year and then to have them go back and make them wear the face coverings, given the low rate amongst children, to me, now you have children who are depressed, you have suicide, you've got a high percentage of children on psychotropic drugs like Prozac. This is like, the long-term, physical and not to mention social consequences of this it's something that it's going to be reverberating for
Hey,
probably.
look, Charles, I agree with you. And then the biggest one of all, right, is education itself, right? So, with the upper middle class, upper middle class, for sure, upper class, um, when those students were out of school, their families had the means. They would have the means. We don't know what everybody did, but they probably bridged that. Tutors, other resources, stay-at-home people, a stay-at-home parent, et cetera. They probably weathered that. But what happened through this is we had a widening gap where the economically disadvantaged, they're falling further behind. They don't have the resources in terms of laptops and Wi-Fi and broadband and probably some degree of parental supervision in inner cities. That's just real. And so those kids may never catch up again. That's just, they may never catch up again. And the science never supported it.
Even Federal Reserve Chairman Powell said this at the very beginning, that was his main worry, that children would fall behind American productivity and American advancement, and in all of the fields, particularly the science fields, would fall behind if we did this. And I think that seems to be pretty prescient in terms of what's going to happen. And I really don't get it. I mean, why wasn't this honestly reported on? Why was this something? I mean, I know the teachers unions might have something to do with it. Everything to them, they don't care about kids. They care about leverage, and they care about the teachers and getting benefits. So anytime you ask them to do anything, there has. Well,
I want to step in for a second. So there's a lot of teachers that I know personally that didn't stand for this and they didn't support it. I want to be on record. I know a lot of teachers that thought this was total bullshit. That's just, I do. And while the headlines went to the New York and the Chicago and the Los Angeles and San Francisco unions, teachers unions, that's not really representative of everywhere, right? I mean, Florida schools were open, Texas schools, across the South, even Michigan was open this year without face masks required at all times. And so it's I don't want to generalize this, right? Kids got hammered in the 2020 to 2021 school year. Very few school districts had 100% occupancy, et cetera. That's just a lost year. But this current academic year, we had a number of normal protocols and a number, in millions of students. And just because we had the outliers of, Los Angeles and Chicago, et cetera, the ones. I don't want to sweep that generalization across all teachers or unions, because we had some great people out there that were fighting hard. And how do you overcome? You can't overcome your union, and you can't really overcome your politicians if you live in Illinois. What do you do? I mean, rampant depression.
I don't blame teachers, at all.
Even Massachusetts, by the way, had where you are had very tight restrictions for a long time, and not warranted by the science.
Oh yeah, I mean, still in this state, it tends to be by the city and town, and so ironically, the first city to end the mandates and the masks was Somerville, which is also very, very liberal, and in a way, like, for whatever reason, which is interesting, the whole thing became political. I think a couple of months into it, at first it wasn't, but then the political battle lines were drawn, and the more masked someone was, the more liberal.
By the way, liberal, but I'm going off memory. Somerville's a pretty working class area community, right?
That's true. That's true.
So,
but it tends to be like Cambridge light. It's a lot of Cambridge people moved up there, and it just has that reputation. So they dropped the mandates even before. I mean, now Boston is doing it. I mean, I actually think that some of these states, particularly the so-called blue states and the very liberal states, I don't know if they would have ever have done it if it wasn't for the great and courageous Canadian truckers. To me, I mean, they woke everyone up, when they first went out and they said, look, we're only out here because we're standing up for freedom, and we don't want to have to be getting passports, and we don't want masks. the COVID-19 pandemic is over, and even if it isn't over, we're going to be responsible for our own health. And so they showed up, and the prime minister said, "Oh, you're Hitler. You're like a Nazi." They said somebody went out, waved a Nazi flag,
Right.
and yet and nobody bought it. They were hugely supported, and not only were they supported by like 60-70% of people in Canada and the United States, but they triggered movements all over the world. Australia, New Zealand, Paris, Vienna, I think even Israel.
Well, I think
to agitate, and that's why the mandates are coming down.
well, so I've got a different take, and we can kind of debate this for just a second. So
Sure.
my take on the reason the mandates went away is twofold. One, we had enough communities and states that had light restrictions without worse outcomes, like Texas and Oklahoma and Florida, the states. And and so what I noticed, I didn't see this reported on, but I noticed this back in the probably around August when schools were coming back and restrictions were talked about. Most of the Republican-led states were relaxed in restrictions, and kids were getting back in class, and they had kind of no governor orders, but if the local community did, maybe in some cases they got it by. But the blue states that had, let's say, shaky standing, or they could be in a swing environment. So take Michigan, take Colorado, for example, take a number of the Democrat-led states that weren't locks, and they buckled and folded on restrictions late last summer too.
Okay.
The holdouts were the states that were so solidly Democrat that they really weren't vulnerable. California, Oregon, Washington, Jersey. Well, Jersey's election was over. New York, and then several in the Northeast. So I think it's highly correlated to vulnerability and
vulnerability to, in what sense? You mean in terms of health?
Whether the trucker convoy in Canada happened or not.
Okay. I mean, I just think that was one of the tipping points, but yes.
Well, it was a big story, but I think that was in motion before. I think the COVID fatigue is getting rampant. Oh, yeah. But I think not just COVID fatigue. I think the news is seeping out. I bet you if we'd have gone back in time on January 1st and polled all the parents in California, Oregon, Washington, New York, pick a couple others, Connecticut, yours, and told them, hey, did you know that all the kids in Florida and Alabama and Georgia and Oklahoma and Texas, et cetera, did you know Arizona, they're not wearing masks at all, and their outcomes aren't any worse than yours? That there would be about an 80% polling that would say, no, we didn't know that. And I think that news is getting out.
And also, I think that there was, look, I mean, I think the thing became political partially, and I know I'm generalizing here, because I think that it was seen as a way to remove Trump from office for a second term. And that's why you had the blue states all locked down and the red states not so much. And I mean, in a way, the classic example of that was that Cuomo in New York, he put COVID-19 active people in nursing homes instead of putting them on the naval hospital ship President Trump sent up to New York with like 2,000 beds and a fully trained, some of the best medical people in the world were on there. That ship sat there in New York Harbor empty for 3 weeks.
Right, the Comfort was empty. Can I take a minute? I wrote about this actually back in the moment. I wrote a whole chapter in both books on nursing homes, and I'm going to go on. Look, this is the third time we've talked. I'm obviously not a fan of how Governor Cuomo had handled the pandemic, nor Governor Newsom. I'm not. I don't think they did a proportionate response, but I did defend them a little bit on the nursing home policy, and I want to explain why for a moment.
Okay.
So if you kind of put yourself in what was happening back in the moment, we had this Imperial College model that came out. It predicted all these deaths. New York was clearly getting a little bit of activity. Italy was getting really hammered in northern Italy. And I think that if with all that rush, and if you actually believe that hospitals were going to be overrun, and I don't think that's a crazy thought on the cautious side in March. I was following the cruise ships. The numbers weren't adding up to me relative to the models, but let's just say there's a little forgiveness for decisions made then. I don't know that it would have been intuitive to a Governor Whitmer or Newsom or Cuomo or Murphy, et cetera. I think there were 6 of them. I don't think it would have been intuitive to say, oh my gosh, we can't send COVID positive patients into nursing homes for fear of overrun because that would spread. I don't know that would. Here's who's really culpable in that. The people that do this stuff for a living, Dr. Fauci, Dr. Birx, Dr. Redfield, every HHS secretary, that's what these people do. It should have been intuitive to them immediately that you can't send. The data was out there from Italy.
I think it was intuitive to a 10-year-old. You don't put someone who was actively infected and contagious into a nursing home.
So I agree. I agree. But I agree. And these are bad decisions. But the people that do this for a living, it should have been as instinctive as Derek Jeter turning a double play at shortstop. I mean, it should just be.
Of course.
Like
and it was. And look, I mean, look, we could go back and forth on this issue. I would only say that I think it had everything to do with the fact that by using the hospital ship, Cuomo was afraid it might make Donald Trump look good. And so he didn't do it because he wanted to keep it. And the media reported that because they were feeding this very irrational narrative that everything that Trump was to blame for millions of deaths and that everything was to be blamed.
But Charles, it's not even just the U.S. Comfort. What's the big convention center, the Kravis? What's it?
The Kravitz Center.
Yeah, so they converted that. They had a couple thousand beds there that went unused too. So it wasn't just the Comfort. Okay. They also had overflow capabilities at the convention center, and that didn't get used either. And that would have had no Trump effect. So, I think that there was a little bit of fear, genuine fear in those weeks in March that they might get really overrun. I think they erred on the side of caution. I'm not standing in those decision-making shoes. Governor Newsom, when he did it, he had no activity. There was zero COVID activity in California when they locked down and did the first policy. But again, a lot of forgiveness when the data was new and nobody was really sure and it was hype. No forgiveness by the summer of 2020. The data was then, like we knew who was at risk, the underlying conditions that were correlated to a hospitalization and a death, the age stratification, that kids weren't involved. We knew everything by the summer of 2020. But I'm a little forgiving on the things that people did in March.
Now I want to ask, I'm going to bring up something that we have to be a little careful because there's still political censorship. And so we can't use the names, and I think I talked about this with you last time. There are FDA approved safe drugs that are being used and were used all over the world. These are generic drugs, so the drug companies couldn't make big money off of it. And they've been used going back really decades on a variety of illnesses, including viruses. And they were proven to be relatively effective in the treatment of COVID-19 in various countries around the world. And yet in this country, they were not banned, but it was difficult to get them. And the general media campaign and the doctors like Dr. Fauci and others put a lot of shade on them and the use of these drugs. Why do you think that is? And I mean, it seems to me that the idea of early treatment makes sense, and it's been done. I know people who have had that treatment successfully. We know a couple of big names that had that treatment successfully. Might I mention Joe Rogan and Green Bay Packers quarterback Aaron Rodgers, among others. Why did they make it difficult? And I mean, isn't that a responsibility that where they could have saved who knows how many lives?
Well, let's take almost a step back here. First off, where we failed as a country, and the CDC inherited COVID, and they were the de facto, policy organization on this. There were no randomized clinical trials on anything throughout the pandemic, not on masks, not on therapeutics, not on vaccines. And then the data that's been accumulated, believe me, there's a mountain of data sitting in Atlanta and in Washington, but it hasn't been released. I can judge that, but let's just go with this.
Okay.
No randomized clinical trials really on anything, including therapeutics. And so I think that we knew, the people that were really studying this knew when the trial data was sketched, it was, little bit of it was released with Moderna and Pfizer, there was no way the efficacy could be 95% based on their trial data, right? It just couldn't be. And I will give Fauci this, right? I hold Fauci in less contempt than a lot of people personally, because I think Fauci's actually a really smart guy. And I think he's got controlled messaging. I actually think that the CDC and our Surgeon General, they're really not in Fauci's league intellectually. Mm-hmm. Fauci knew these vaccines were leaky out of the gate. And that's why his original message was, you need to keep wearing masks. If you remember that and go back to messaging in November and December, 15 months ago or so, Fauci said masks need to stay on. Why? He knew. So whether he's a believer in masks is a different question, but he knew the vaccines were leaky. The point here is we failed by not having any randomized clinical trials to really measure this. So instead, you've got people like me doing massive large body comparisons of data, broadly speaking, on trying to correlate things because we haven't done a trial. And I would argue that the burden is on someone to shoot holes in my data. And I'm clearly not the only one. In fact, I've had a lot of helpers on this. But if somebody can tell me there's a better correlation than obesity, I would love to debate that and discuss it. And if I could learn something, I would. But super high correlation on obesity, right? But on your therapeutic question, I would argue the jury's out on those things, right? What we don't know is, would Joe Rogan have gotten sicker if he didn't take it? I don't know, and neither did Joe.
No, I get that. I mean, it's sort of like the Latin term post hoc ergo propter hoc. Because he got better, and he took the thing, he got better, therefore you credit the thing, but that may not be true. I mean,
he took like four things. He took like four things, and he's
right.
He's not a skinny guy, but he's healthy and he's fit. And
right.
So he wouldn't, I think he's like 52 or something. So he wouldn't be, in the highest risk category. We don't know that. That's not Aaron Rodgers could have gotten an IV of COVID and probably not gotten sick, right? The guy's young, he's healthy, he probably eats well. He would be an extreme outlier to have a COVID.
Oh no, those guys are like supermen. I mean, people who are professional athletes.
Yeah, and you can't really blame, and which is why Novak Djokovic fought so hard to avoid getting vaccinated. He'd had COVID.
Right.
There's really no science that suggests that once you had COVID, you should get vaxxed. I'm sorry, there's no data, and there's no clinical trial data either. And so anybody insisting that natural immunity is inferior to vaccinated immunity, the data just doesn't support that. Not in Scotland.
Well, let me ask you about that. I mean, is natural immunity, because that traditionally that has been a thing. I mean, like in the old days, if a kid down the street had chickenpox, people would come over and visit him so they could get immunity. And you would have that. Is that a thing with COVID-19? I mean, or is there any data on that?
Well, yeah, you're leading me because I know the answer to this too. Yeah, I mean, there's no doubt that in the first year of COVID, I couldn't find an article or a study that cited a dozen cases of reinfection where you had COVID in the alpha and you got reinfected. It's happened since we got variants, but I couldn't find any cases of it. And so where did we fail as a CDC compared to maybe the data's probably accumulated in part of Great Britain, and probably Israel seems to have the best data going. But how many people have gotten vaccinated and gotten infected, how many people had natural infection, recovered, got reinfected, and then how many of each of those two groups ended up hospitalized and got sick. And you'd have to factor in age and underlying conditions and roll all those things together. I guarantee you that data all exists. They just haven't released it. But every study that's been published, natural immunity recovered is superior to vaccinated immunity. I got vaccinated and so did you. That doesn't mean that either one of us don't believe there's protective benefit. What we're really talking about is creating policy around this stuff. That's what we're really debating.
Well, then why did the CDC and Dr. Fauci and them say that people who had COVID-19 get vaccinated?
Charles, I don't know. The science.
And why isn't the CDC releasing this essential data? I mean, there has to be, look, there has to be.
The answer to your second question is, if they released all the data that they have, I think it would undermine their messaging around vaccines, but not, let's just say everybody get vaccinated. That's one thing. It's very different when you start terminating employment and keeping kids out of school. And
it was so vicious the way, I mean, the US military, they were talking about if you didn't want to get the vaccine, you had to leave, and they wouldn't even give you an honorable discharge. And these were people who had been in the military for 30 years, who just said, something, I'm not going to do this. I don't think it's the right thing for me and my family, and I'm going to resign. No, you're going to lose your everything. You're going to lose your,
And the crazy thing is, it's almost like before the vaccines, you think, well, how did we function, right? And so if you look at the Roosevelt aircraft carrier, one of the things I studied, COVID swept through that early on.
Right.
And we had one person in the military die, and that individual had underlying conditions. I don't know how serious it was. Honestly, the data's been not a lot of data has been released on that individual, but it was one person out of, I don't know, several hundred or 1,000. I don't remember the data. I'd have to look at it. But it was most of the military personnel on the ship, they got COVID. The majority of them.
Yeah, sure.
And there were very few people that got sick. And so you wonder in the military, again, when you're talking about the military, particularly frontline soldiers, you're really talking almost in some equity to professional athletes. These are very fit, healthy men and women. They would statistically be a very, very low risk of a bad COVID outcome.
So look, I mean, to make a political statement here at this juncture, I think that the only way we're going to ever have any hope of getting to the bottom of these questions and find out exactly what happened in terms of public policy with COVID and where the science left off and politics began, not to mention the topic we didn't even discuss yet, which is whether or not this was as a result of gain of function research. All of those questions, the only way we're going to get to that is if the Republicans take back both the House and the Senate in the midterm election, and enough MAGA people are included in the Republican victory, then we'll have hearings. So, and then we'll have testimony, and we'll have cross-examination, and we'll have a report, and the American people will get to see and hear exactly what happened. We'll put all these people.
So, Charles, let's say there were some records, like we got into Fauci's emails and there wasn't much of a smoking gun, other than clearly there was a gain of function discussion. We can get into that if you want. That's real. I mean, the lab theory is real. And he was anti-mask early, and whether he was posturing, forget all that. But at the end of it, the federal government doesn't set any policies except maybe wearing masks on planes, right? I mean, in general, the federal government isn't setting policies. It's governors. We live in a republic.
Governors do it, yeah.
And so I don't know how, I mean, the data is pretty public. I don't know that there's going to be a conversation that a Republican committee is going to uncover that's going to have Newsom and Governor Pritzker and Whitmer and Cuomo sitting, on a conference call colluding. That's not going to happen. At the end of it, I think that
Well, I don't care so much about them and about the governors, even though I think that, I mean, we could find out whether or not the science would bear out whether these things were necessary at all.
I think we know the science. I mean, what I'd argue isn't, I don't think we're going to uncover much. I think it's more, how do you see the science, right? I mean, though it's almost like you can have a debate with somebody.
No, it's
and somebody can say,
it can happen again. I mean, we have to, this is, the state of emergencies are still there, even though they are letting people not have the mask and all of that. It's still, the governments are still holding that power in abeyance, and they can release it again. So we've got to get to the bottom of these questions. We have to get to the bottom of the gain of function question. I'm not saying I know what that is. No one knows.
I agree with that.
But if we don't get to the bottom of that one, then they could do it again. And we have to know what the heck was going on. I would hope that in the future, if God forbid there's ever another pandemic, or if there's ever another incident like this, we won't have the lockdowns. We'll have people who decide to lock themselves down. They'll
Right.
have, they'll decide to wear the mask if they want, if they feel it's helpful to them, great. But, and hopefully we'll learn how to lose weight a little bit, maybe get healthier, improve our immune system. I mean, but the idea of these big statewide lockdowns, I just hope, if we don't have here, we have to never do that again. And the only way to get there is to have these hearings.
Well, so I agree with that. And I think Rand Paul's, probably thirsty for
Yes.
something like that. I mean, I think he's done some excellent cross-examination. I'm all for that. But I think at the end of it, it's a situation where, let's say 1,000 people per million died in a given state. One person's going to say, you lock down to save 1,000 out of a million, one in 100,000, whatever, it's some number. You lock down for that, and somebody else would say, yes, we locked down for that. That was a huge number. That was worth it. And somebody else would say, it's not worth it. 7 million people.
I think that what they'll say at the end of the day is, lock those people down who are vulnerable. Lock yourself down if you feel that you are not well. Take responsibility for your own health. Be locked down. I mean, look, I know people who should have been locked down. I mean, as do you. I mean, elderly people who are, even a couple of people in my own family. I totally get that. But the point is, you have to make your own arrangements within the family to figure out how to protect people when there's a disease afoot.
Well, and then play out. I'm sure you saw it, the movie Outbreak back in the 90s, right? If this was like the Mataba virus, right? Right? If this was like the movie Outbreak, you could make a pretty strong, in my opinion, bulletproof argument to lock down if it was like the movie Outbreak or the movie Contagion or something like that.
But even then, I mean, it could be very isolated to a certain area. Like
maybe. I mean, then you get into more variables that we need to go down right now.
Contagion. I remember that movie with was it Dustin Hoffman and a couple of people. Horrifying movie, and they locked down this one city. They literally surrounded the place with barbed wire, and they putting food through a hole, and they were ultimately they found an antidote. But that to me seems to be more reasonable than to lock down the whole country.
Well, right, but remember Patrick Dempsey's character had made its way to Boston, right? He got on the plane, he went to Logan, got sick, a bunch of people in Boston got sick, and then it started to spread. And so they really needed to come up with that host monkey. But where I was going with this is that there's a situation with the CDC and the media where it's been a little bit of it's been a lot of crying wolf. And so it will take time. Trust will come back. This isn't existential or anything. Trust and confidence will come back over time. But what if it's real, even more real than COVID? And we really do need to have some legitimate restrictions. And did we burn our bridge? Did the media and the CDC burn their bridge with Americans or this generation?
Next time, no one's going to believe. It'll be like crying wolf, as you say.
It could be. I mean, it could be. I think that's the situation with the vaccines.
Rand Paul talked about that when he was talking to Fauci, why it was important to know if this was gain of function, because next time they might do one that could wipe out about 20% of the entire population of the planet.
Yeah, I've studied a lot on most of the things that are most of the data that's out there that's public. It seems impossible that it didn't have a gain of function association and didn't source from the lab. There just is no other.
Well, I think it's
plausible.
even the New York Times admits that now. I mean, I believe a group of scientists from around the world went to the lab in Wuhan, China, and they came out of that, and they weren't even allowed to see half the stuff, but they came out of that convinced that this is exactly what happened, and that's why the New York Times went out with an article saying this. I mean, they didn't say it flat out, but they said this. Yeah, this is a very big possibility.
And that idea suggesting the lab theory was banned on YouTube and Facebook and maybe other places.
That I'm worried, as we're talking about it, I'm wondering if I'm going to get shut down now.
I think Redfield paved that way, right? I mean, he helped and said, what's that?
The cat's out of the bag at this point.
Yeah, I think the cat's out of the bag on that one. But so you look at all these things that seemed like facts, or they were representative of not, being somewhat airtight. And over we're seeing that that the message that we were given and that we were shut down and ostracized if we questioned. It's almost like a running joke. I don't know if you subscribe to Alex Berenson's newsletter. Do you?
No.
Do you know who I'm talking about?
I do know who you're talking about, yeah.
Yeah, so Berenson gets kicked off Twitter, and The Atlantic last year ran an article called "The Pandemic's Strongest Man," and so Alex he sends out about an email a week called "The Pandemic's Strongest Man," and basically vindicates himself on like new stuff that's coming out. It's pretty funny. I think the guys are really good. I've exchanged a lot of messages with Alex through this, and I think he's done great work. But one of the things that's funny is The Atlantic calls him the pandemic's strongest man for assertions he made about the vaccines and other mandates back in first quarter last year. And, I've read that article about 10 or 15 times in The Atlantic. I still can't find anything Alex was quoted in that article as being wrong. But my point in all telling you all that is because Alex was on the front line of all this. Is all these things that were accepted as, you're crazy and you're some sort of, right-wing loony, but sadly it was even politicized because, like you and I've talked and you'll lure me into politics, but I generally would prefer to stay on the data because I don't want to I could get into the politics, but the data is so strong. I don't want to get into the politics.
The data speaks for itself.
The data speaks for itself. But all these things that were accepted as, oh my God, you're crazy and you want to kill grandma, and all, it's all been, proven to be true.
Oh, I mean, look, even Alex Jones has proven to be true. I mean, he was saying, look, they're going to come out with these electronic passports and that they're developing a computer chip. Oh my God, the tin hat, the tin hats. 60 Minutes just did a piece where they interviewed scientists and doctors who said, yeah, we're developing a computer chip and here's what it looks like. And the guy had like glassy eyes, like he's in a cult or something, the doctor who they interviewed. And that, this is going to tell us like what's going on with your body, and it's going to, send information to a computer. So he was right. I mean,
so one of the theories that was floating early was that there was a secret chip hidden inside the vaccines, which is
that's maybe a little bit of a stretch, but
that is one of the things that was circulating, and that was just the dumbest thing,
well, of course, some of the stuff is garbage, of course, but some of it, it's difficult. You have to kind of separate the wheat from the chaff, so to speak. But I mean, the issue of like the passports turned out to be very true, and the thing I don't understand about that, now that we're on the topic, if you get the vaccine and you still can catch the virus and you can still spread the virus, are you going to spread it less if you've had the vaccine or about the same? Is there any data on that? And even if you are going to spread it less with the vaccine, why the passports? You're going to spread it. You're going to spread it whether you've had the vaccine or not.
It's a good question because
I'm not against the vaccine. I just want to be clear. It's a personal choice. And if you want the vaccine, get the vaccine. But to me,
No, there's no other, hold on. There's no other,
it's a personal issue.
you got the vaccine and so did I. So there's no debate here. It's not like either one of us is saying.
Mind my good friends over at YouTube, that's all.
Yeah, right. Yeah. But like, more like just for credibility, like I'm for this. You could only make an argument for a vaccine mandate if it offered a public benefit.
Right. Exactly.
And it doesn't. It offers a probably measurable private benefit. And
Sure.
for that reason, if you're all the things that we talked about earlier in this call, you should probably get it. But the idea of a vax mandate when it doesn't offer it doesn't prevent infection nor transmission, I don't know how you stand up to that argument. I just don't. And then when you factor in side effects,
yeah,
I just don't know.
Well, the thing that I find even more troubling is this idea of the passports, and that you're going to have to if we have to end up with electronic passports, forget it. Freedom is.
Well, this is all going away. I mean, this thing's crumbling like by the hour. It feels like, but in America's defense, it's not just America, right? I mean, like America's been like a paradise compared to New Zealand and Australia.
Oh yeah, they've had concentration camps.
Yeah, and so America's been in the mix. Canada, I would argue, has been a tougher place to live than America. For sure, tougher than living in Texas. So America's not. There's a couple billion people that have been under severe lockdown or restrictions and compromised liberties, which only work if the data doesn't support it, which it doesn't. Mm-hmm. But America's not alone in this. I don't want to. It's not like we're picking on our leaders. I couldn't have been more pissed off at Governor Abbott in Texas here when we had closed schools and mask mandates in schools, and I had to wear a mask to go to the gym. But that's just how the tide was rolling for a little while. And so
right. But I mean, I want to wrap it up soon, but I just want to say that the idea of the passports, it seems to me to be very irrational if you can spread the virus, whether you've had the vaccine or not. And it does bring up some rather sinister political questions, which I'm not going to get into right now because we're live on YouTube. Let's just say it might have something to do with an organization that operates out of Davos, all right? But we'll leave it at that. So, Michael Beatrice, where can people get your excellent book? And do you have a website you'd like to share?
I don't have a website, but I've got the two books, COVID-19, Lockdowns on Trial, and the new book is COVID-19, The Science versus the Lockdowns, Amazon, Barnes & Noble. And anybody can reach out to me anytime. My contact information is on Twitter and in my books. Love to hear from everybody.
Okay, and I just want to mention as a program note, tomorrow I'll be joined by Dr. E. Michael Jones. All right, Michael Beatrice, a pleasure as always.
It's great. Good time.
Yeah, let's stay in touch. I mean, keep me up to date on any of your developments, and we can do some more programming.
I would love to do that. Thank you, Charles.
All right, thanks a lot, Michael. Have a good night.